Struggling to keep your vision on point? Help is on the way for those who want to see things more clearly. Joining us are ophthalmologists Dr. Alnette Tan, whose specialty is laser surgery, and Dr. Joanne Bolinao, who focuses on refractive errors. Good morning, beautiful doctors. It's a beautiful day. Welcome to the show.
Good morning. Thank you for having us.
Okay, I'm going to throw my first question to Doc Joanne. Doc Joanne, what are the most common refractive errors and how do they impact vision?
Well, refractive errors are actually your nearsightedness, farsightedness, and astigmatism. So this is something genetic. So when we are born, there's a certain size and shape of the eye. If your eyeball is longer than normal, you get nearsightedness. If your eyeball is shorter than normal, that's farsightedness. If it's not round in shape, that's astigmatism. Okay, so all of those at a certain level, no, if it's usually in children because they have good focusing mechanism, something lower than +1 would be manageable without glasses. But if it's higher than +200 for farsightedness, higher than -1 for nearsightedness and astigmatism, that would impact their distance vision. If you're younger than 40, you won't have any problem for reading. But after that age, it becomes more complicated. So you have difficulty distance and reading. So in those cases, you can either have glasses, contact lenses, or if you don't want to wear glasses or contact lenses, you can have refractive surgery, LASIK, SMILE, and the things that we offer in American Eye.
Doc Joanne, so I have nearsightedness and I have astigmatism. So can that worsen over time, or any refractive errors for the matter?
Because she can't see you po.
My contacts ako today.
Okay. So nearsightedness kasi, so that's from the elongated eyeball. So that's something that normally would change up to age 18 or 20, but nowadays we see it even in adults because it may worsen if you lack sunlight, outdoor activities, and if you have more near work, reading, computer work, gadgets, so that may increase. However, most of the refractive errors would actually stabilize at the age of 18 to 20. Astigmatism can also increase or it can worsen if you keep scratching or rubbing your eye. So avoid doing that.
Oh, okay.
Doc Alnette, I will turn to you now because you specialize in laser surgery, if I'm not mistaken. And at the same time, my partners here were all really excited because they all want LASIK. When you talk about the type of laser surgeries that are available, and of course, if there are any misconceptions, because it feels like it's more than just LASIK. Could you tell us a bit more about yung field po ninyo?
Okay, correct. So what we do with laser refractive surgery is treat the cornea. The cornea is the front part of the eye, yung pinapatungan ng contact lens. Okay? So there are three more common procedures to treat errors of refraction. The first one is PRK, or photorefractive keratectomy. That is what we call in layman's terms surface ablation. So kung ito yung cornea, dito lang talaga sa harap ng mata ang laser, okay? To change the curvature of the eye, to treat the grade. Now, with LASIK kasi, imagine nyo that it's a flap-based procedure, meaning there is a laser that creates a flap, it etches a flap, then the doctor lifts the flap, tapos yung laser sa stromal bed, and then the flap is placed back. So this leads to faster recovery kasi like 4 hours lang ang discomfort, and then we usually just tell the patients to sleep it off. The next day they're functional na. There is a newer or more innovative procedure. Instead of the flap, there is a laser that creates a tunnel, and then yung kailangan na flattening, it's a longer tunnel, which we call the lenticule, and this lenticule is taken out of that small tunnel. So walang flap. That is what we call SMILE, which is small incision lenticle extraction. The three procedures aim a target to correct the error of refraction of the patient.
Well, Doc Alnette, I'll tell you right now, after your description, ayaw na nila mag-laser eye surgery.
It sounds so complicated.
But of course, all joking aside there, when you take a look at the qualifications of the people who are actually eligible for laser eye surgery, what are those qualifications? Are there people actually disqualified from being given laser eye surgery?
Well, as Dr. Bolinao said, we want usually 18 and above, no? Kasi we want the grade of the eye to be stable. And then also, we make sure that there is enough cornea or thickness of the cornea, and also that there are no other abnormalities of the cornea. Plus, talagang LASIK lang or laser lang yung kailangan, because there are people who come to us, they already have cataracts and other problems like glaucoma, retina. So we have to really screen, do a very complete screening for the patient to make sure that it's just the error of refraction that is the problem.
Doc Alnette, when you do LASIK or any laser eye surgery, is it just a one-time thing, or can you get it back and then you'd have to do it again? And typically, does the recovery process hurt? Because I've heard some people who've gotten LASIK and it's a mixed review. Like some don't feel anything and some they have some stinging pains.
Yes, okay. So first of all, it's just a 15-minute procedure, meaning we are inside the laser room for around 15 minutes. But that already includes good morning, good afternoon, and cleaning. So the laser treatment itself, it's around 20 seconds. After the procedure, it's the usual recovery time or the feeling of stinging and tearing, sensitivity to light will be for around just 4 hours. So as I mentioned, the patient just needs to sleep it off. Now, with regards to, what was your other question?
Is it just one time? So once you do laser,
yes,
is that
one time,
it? Or do
okay.
you have to do it again?
Yes, that's a good question, because we are treating human tissue here. It's not just like paper that when we cut it, it's forever that way, right? So human tissue, even as we speak, there are cellular processes going on. So a little grade might come back, which with our laser refractive surgery, we can always add laser shots later on. When I say a little grade, it will be just my 0.50, 0.75. Like for example, if your grade is 300, it will not go back to 300. So it's just a little touch up later on. And the percentage of that, like maybe 2.5%, meaning 2 out of 100 patients need additional laser shots.
For Doc
Can
Joanne.
I add something?
Oh yes, go ahead.
Can I just add something regarding the pain after surgery? I actually had LASIK myself in 2004. When I had it done, it was still the old technique, the bladed pa. And I can tell you now, well, during the surgery, you will not really feel anything. You will probably just feel the pressure, the lights will fade. So that's probably the scary part, but it's just a few seconds. It's after the surgery that you will have some discomfort. Imagine a dirty pair of contact lenses stuck inside the eye or sand inside the eye. It'll just feel like that. Probably for the first 2-3 hours. Sleep it off. When you wake up, by the 4th hour, you'll be okay. A little hazy, but you're definitely functional, tolerable, even without pain relievers. So,
Doc Joanne, let's talk about the non-surgical treatments like orthokeratology or atropine drops for myopia control. Are these effective as well?
These are usually offered for children. All right. So since the eyeball is still growing, we expect the eye to really change in size and shape. So the grade would also change. It would also increase. There are actually good evidence. No? So in medicine, we have level of evidence. Good evidence that would really slow down, not stop. It will just slow down the progression of nearsightedness would be the atropine drops. Sunlight, pinaka-important. That's globally, all studies would show na if you have an outdoor activity, if you spend time outdoors, the progression of myopia will slow down. Atropine drops have been used but there are still parang questions, no? What concentration, how frequent, and then there are cases na after you discontinue, it will just parang catch up, it will rebound. So we use that, but you still have to be monitored. So the best would be sunlight. Orthokeratology, it may also slow down, but the problem there is that you're going to sleep with contact lenses on. So the idea in orthokeratology is the flattening effect on the cornea, which actually what laser does, di ba? It flattens the cornea. So yung orthokeratology, imagine yung braces, the teeth. So you're just flattening it overnight. When you take out the contact lens, during the day it's flat, but it will unmold. So end of the day, blurred na ulit yung vision. You'll have to wear it again. So the caveat there would be yung infection. So you're sleeping with contact lenses on. Normally, we would tell people and patients not to sleep with contact lenses on because that will increase the chance of infection by 20%.
Now, Dr.
So,
Joanne, sorry to cut you off, but I just want to debunk a quick myth right now.
Okay.
Because, people always say if you eat a lot of carrots or drink carrot juice, that helps your eyes. So this is my question. Can diet and lifestyle change or help the eyes? Or
well,
actually
healthy
make it
living
worse?
definitely overall, vitamins are important, but no, eating carrots and other healthy stuffs would not prevent any refractive errors or any eye problems. So, but you still have to eat healthy.
Yeah. And if you eat a lot of carrots, can I just say you actually can get orange skin?
Yeah, that's
Wait,
true.
I didn't know that.
Yeah,
Yeah,
you
your
can
skin
get orange
turns a
skin.
tinge of orange.
Oo. Like,
Yeah.
pero ganun pa rin
I'm
yung
gonna
mata
look
mo.
like an Oompa Loompa.
But then, of course, Doc Alnette, a lot of people are also wondering, speaking about myths and debunking them. I'm not sure if this is true, actually. That's why I want to ask. Some people want to have laser eye surgery done because they want to stop wearing glasses, because they want to eliminate the need for doing that. I actually had a friend who went to had eye surgery done for night blindness just to try and make life easier. What can laser surgery do for those who have lived majority of their life with contact lenses or glasses?
Well, that is really the target or the goal of laser surgery is to remove the dependence on glasses or contact lenses. So the laser procedure makes a patient functional without glasses and contact lenses. So we correct the errors of refraction.
Doc Alnette, what are the risks and the potential complications of laser procedure?
The most common complaint really is dry eyes, which is manageable. And usually the dryness is, it dissipates after a few months after the laser treatment. Of course, this is still a procedure, so infection is a possibility, but very, very rare since we started doing laser since 1995, and I can probably count maybe less than 10 patients who developed infection, and those were handled quite well, and they are seeing very well right now. Basically, that's it. It's a very low maintenance procedure. I think the very important complication that we want to avoid is an unhappy patient. That's why when we do screening, when we talk to the patients, we manage the expectations. Number one is it is really not, we do not guarantee 20/15 or your eagle vision or HD vision. What we give is functionality. You are functional. You don't need to grab your glasses to see, or likewise, unhappy patients who we do not change the color of the eyes. May nagtatanong, magiging blue ba yung mata ko? So,
Well, that's unfortunate. Now I'm reconsidering. But Doc Joanne, Doc Alnette, let's try and figure out also right before we go for some more practical advice, because we now live in a time wherein everything happens via a screen. We're talking to you right now via screens. We are a lot of the kids right now still do classes using tablets, sometimes from at home. A lot of work is done from home. You work with so many laptops. Are there any recipes or any remedies that you guys can suggest, especially when it comes to potential protective eyewear, corrective eyewear, when they are trying to make sure that they stay healthy amidst all the screen time we have? Doc Joanne, I'll start with you.
Okay, so being a pediatric ophthalmologist also now. So those protective eyewear, they have low evidence that it will really protect your eyes. So we don't actually recommend that. In fact, diba, we want you to stay outdoors. Sunlight will actually help slow down the progression of nearsightedness, and sunlight has more blue light than your computer screen. And then remember also the 20-20-20 rule. So that's every 20 minutes, 20 seconds rest, look 20 feet away. So that would be hard to time and to look for a space na 20 feet away. So recommended is when you study or when you're on your online class, siguro face the window so that you can gaze outside the window, look at the sky or the street so that you will have that parang break from focusing or accommodation.
Doc Alnette, how about you?
Yes, you know, the 20-20-20, medyo mahirap yun, lalo na like when I talk to my patients who are usually like adults, like working on their computers and watching Netflix. So I go 1 hour, kasi episode ng Netflix, di ba, 1 hour. So, and then they can rest for 1 minute. And then, you know, just, you know, come back or just try to, and also we have patients na pala who like, they're on the laptop a lot and then they work on spreadsheets, documents. That also will lead to especially dry eyes, no? So rest for every hour or rest, look far para hindi lang masyado nag-eye strain.
All right, thank you so much for joining us today, Dr. Alnette Tan and Dr. Joanne Bolinao. We learned a lot from them today. Thank you so much.